What else does dextrose do? Now let's take a look at nerves, because this is a newer area. Shortly after Dr. Liftoff began his work with perineural injection treatment, Dr. Lam in Hong Kong and Dr. Wu, Youngsan Wu in Taiwan, began working with hydrodissection of nerves. And a number of things have already been found out despite the short period of time in research, and this is all human research. Let's first look at rapid analgesia. Dr. Smigel performed 3 different studies on the caudal epidural injection of D5W. She first showed that a very small needle could be used to perform a caudal epidural without any risk of lumbar puncture and much more comfortable than standard methods to inject dextrose 5%. Then she did a study published in 2017 to prove whether that caused analgesia or pain relief in patients with low back pain and buttock or leg pain. So these were patients with diverse causes, all comer, and she used the vertical small needle approach. That was the first study. And there were differences between, that was the second study, and there were differences between the second study and the third. In the first, she did a double-blind injection on one occasion of 5% dextrose versus saline in the caudal epidural space and followed up for 2 weeks. Then at 2 weeks, participants were offered to continue on open label. So in the 2018 publication, these patients were injected open label, and this was repeated 4 times every 2 weeks and then by request. This is the result from the 2-week randomized trial. Dextrose was injected as shown in the red, and saline was the blue group. And you can see the improvement in the NRS pain scores. These differences were highly significant. And you'll notice that by 50 minutes, the difference was apparent between groups. That was the first point at which a measurement was made. 2 out of 18 saline participants didn't receive the full dose due to a pressure sensation, and their data was removed for per protocol analysis. That would have caused a bias toward the dextrose group, and that was not what we wanted. So this is a per protocol presentation, including all the dextrose groups and 16 of the saline. This is the next study and the results. You'll notice here that although it was open label, Dr. Smigel showed the exact same pattern of response of pain after each injection. 15 minutes is the point at which the most improvement has occurred in terms of speed, but then there's a little bit of a peak about 2 to 4 hours, and then by 48 hours, the pain relief is dissipating, and by 2 weeks, it returns toward normal, but doesn't quite reach it. So you'll see a progressive increase in pain relief from the 2-week to the 12-month period. The intention treat was used here. Very little dropout occurred. But you'll notice that despite inclusion of intention to treat, the values continued to improve to where nearly 4 change on the NRS pain scale occurred, and this was without doing any other treatment to these patients. Rapid analgesia has also been shown in painful knee arthritis. This was published in 2022. This study, which we'll talk about otherwise, was for other primary purposes, but it was also to demonstrate analgesia, and it had a blinded portion and an open label portion, much like Dr. Smigel's study did. In the blinded portion, a needle was injected, which actually was used to withdraw synovial fluid. But for half the knees Dextrose 12.5% was injected, and the other half had simulated injections given. And the pain levels were measured before, 20 minutes, and 1 week after injection in the blinded portion of the study. And then, again, like Dr. Smigel's design, there was injection given open label. They were not necessarily given at the same exact time, but they were roughly monthly times 6. And measurement of the pain levels was obtained at 3, 6, and 9 months. Here's that pattern. And I've shown you the pattern of Smigel from 2017. I removed the additional times. I've got 50 minutes compared to 20. And again, you can see that there is an effect, and this effect for analgesia was significant for Topol 2022 as well, not appearing to be quite as much, but you'll notice that at 1 week or 2 weeks, the results are somewhat similar. And if you then look at the 3 to 12 month findings, here is the pain relief in red by Dr. Topol and in blue by Dr. Smigel. And you'll notice that the degree of pain relief, despite for epidurals having that the only thing done, and in knee arthritis having only intra-articular injection done, and yet you'll see the improvements were similar. So again, this suggests a significant pain reduction effect of dextrose, separate from a proliferative effect.